Next, coding guidelines and standards. Introduction. Effective medical coding depends not only on understanding the coding systems themselves, but also on adherence to established guidelines and standards. This module explains the rules and conventions that ensure consistency, accuracy, and compliance across all coding activities, which are essential for proper reimbursement and legal protection. Firstly, purpose of coding guidelines, consistency, to promote uniformity in code selection across providers and institutions, accuracy, to correctly reflect medical diagnosis and procedures based on clinical documentation. Next, compliance, to adhere to regulatory requirements and avoid audits or penalties. Next, efficiency, to streamline the coding process and reduce errors. Official coding guidelines, sources. These are published annually by CMS, AMA, and other authoritative bodies. Content. It provides instruction on code selection, sequencing, and nuances such as laterality, severity, and modifiers. Application. Follow these guidelines for inpatient, ICD-10 PCS. Outpatient is ICD-10 CM. Procedural is for CPT and HCPC codes. Next, basic coding conventions and conformance, abbreviations and symbols. Use of specific symbols like brackets, parentheses, and notes to clarify coding instructions. Sequencing, correct order of diagnosis and procedure codes on claims. Uncertain or incomplete documentation. Coding rules for when documentation is ambiguous or insufficient. Next, use of modifiers. Applying additional codes to specify circumstances such as laterality and complications. Next, specific coding rules. Laterality. Identifying left, right, or bilateral procedures. Next, multiple procedures. Determining primary versus secondary procedures. Next, new versus established patient coding. Differentiating coding based on patient's history. Next, inclusions and exclusions notes. Understanding the scope and limitations of codes. Next, updating and maintaining coding accuracy. Annual updates. Regular revision of coding manuals to reflect current medical practices. Training and continuing education. Ensuring coders stay current with guidelines and new codes. Auditing and quality assurance. Regular reviews of coding accuracy and compliance. In summary, adhering to established coding guidelines and standards is vital for uniformity, accuracy, and compliance in medical billing. Proper application reduces errors, enhances reimbursement, and mitigates legal risks, ensuring the integrity of healthcare revenue cycle. Thank you.